I want to talk about one aspect of self-help. Everybody knows about Lowe's and Home Depot for dealing with your home, and Pep Boys and AutoZone for dealing with your car. We want you to think of Youngevity for dealing with yourself, but there's a certain amount of responsibility you have to take in doing things. For instance, if you do find it necessary to go to a doctor, which is very rarely, you want to get two opinions before you do anything drastic. Don't let them do a brain transplant or a heart transplant or a kidney transplant or a liver transplant until you get a couple of opinions. Doesn't hurt. Okay? Also, I'm going to keep files of all the laboratory work or any physical exams your doctor makes. You get copies. It's your information, and you keep a file of it. Then you want to get a hold of the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy. Get a hold of the book Epigenetics, The Death of the Genetic Through Disease Transmission, and the book Rare Earths Forbidden Cures. And you could do twice a year or once a year, do a hair analysis. You can tell if you're absorbing. Very easy. If all the numbers for all of the minerals, let's say there's 32 to 38 minerals you looked at during a hair analysis, and they're all below normal, that means you're not absorbing, because they shouldn't be all the same level. They should be scattered all over the place, depending on the amounts of minerals in the food you're eating. And so hair analysis are very, very good. I've saved people from diseases or diagnosed with Parkinson's disease, and really they had just an excess of manganese, and you lower their manganese levels, and their Parkinsonian syndrome goes away, because it really wasn't Parkinson's disease. So hair analysis can be extremely useful. And you can do your own blood pressure. You can do your own pulse. Write it down once a month. You can get test strips for $1.50 each for doing your own blood work to see if you have prediabetes or diabetes. You can do a 6-hour glucose tolerance test to see if you have hypoglycemia or active hypoglycemia. And then, of course, you can take your weight. You get urine test strips. Boy, those urine test strips, you can find out a lot about your heart, your liver, your kidneys, all kinds of stuff, your body pH and so on. So you want to get those urine test strips. And then, of course, the colonoscopic exam equivalents, occult blood test. And if you find positive blood, you want to make sure you didn't have a rare steak the day before you took the test. Or it doesn't hurt to get a high-resolution ultrasound. I certainly wouldn't be getting biopsies right away. And then, of course, there's a newer test called the FIT test, which is an acronym for fecal immunochemical test. And let's see here. You can actually do high-resolution ultrasounds, no radiation, and you can do this in place of mammograms. You can do it for prostate exams, colon exams. Let's say you have some bleeding, and you know you have a history of internal hemorrhoids or something. You can do a high-resolution ultrasound. And these are things that are really something. And then, of course, people always ask me about parasites. And this is where I really would have you get a hold of the book Let's Play Doctor. And the book Let's Play Doctor shows you many ways to look at parasites. You will need a microscope for the most part. You can either get one cheaply at one of these thrift stores that somebody's turned in. You can buy them at one of these hobby stores, pretty cheap. Let's say you have a lot of people in your family, you want to be doing the lab work and looking for parasites. Or you can just go down to the local high school when the laboratory is not being used, or make an appointment. And, I mean, you're paying taxes to support the school, so you should be able to use a microscope for a few minutes. And the book, Let's Play Doctor, tells you how to prepare a fecal exam. If it sounds too messy for you, you can actually take some soiled toilet paper, or get a spoon and get a piece of bowel movement out of the toilet, put in one of the styrofoam cup, take it into the veterinarian, tell them it's your dog's bowel movement, and let them do a parasite exam for you. And then, of course, the book, Let's Play Herbal Doctor, teaches you what you can do for the various types of parasites. And so these are things you can do yourself. You accumulate a lot of information. Why would you want to have a doctor diagnose you and have it on your file that you're pre-diabetic? That's going to keep you from getting promotions. That will make your insurance rates go up, all that kind of stuff. Might even cancel your insurance. And so what you want to do is do these things yourself. Let's say, gosh, my blood work says my blood sugar, my fasting blood sugar, which had been running 85 to 90, now it's suddenly 140. Uh-oh. So you want to rerun it, the next day in the morning before breakfast, before you eat, and see if it's still high. If it is still high, then what you want to do is make sure that you begin to do something with like the Healthy Blood Sugar Pack. Or if you have a blood in your urine. You want to get a high-resolution ultrasound, no radiation, but it'll tell you if you have kidney stones, if you have cystic calculi, which is a stone in your bladder. And, of course, if you have high blood calcium, your doctor would want you to say, look, don't you dare take any calcium. Your blood calcium is too high. We're going to take your parathyroid glands out. When you have elevated blood calcium, that means you have raging osteoporosis. You need more calcium, not less. And as soon as you start taking something like the Healthy Bone and Joint Pack, which is going to support healthy blood calcium levels, the parathyroid glands will shrink back to the normal size because they don't have to work so hard. Because when you have high blood calcium, the calcium comes from your bones, not your diet. And I don't know why doctors miss it so badly, but we got to take care of ourselves. The family will love them, this, especially the kids. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I think you'll get a kick out of this headline of a Fox News story. Infections, most common cause of readmissions after surgery. They say surgery patients end up back in the hospital most often because of incision infections that don't show up until days after they're sent home. And they recently did a study on these unexpected readmission rates. And they found that the most 6 common surgeries, the lowest readmission rate was just under 4% for hysterectomy patients. The highest was 15%. For artery disease patients who had a surgery to reroute blood flow to the legs. According to the lead researcher, Dr. Carl Milamoria, a senior author and director of Surgical Quality Improvement Center at the Northwest University Feinberg School of Medicine, says most of these things are clearly related to the surgery. Yeah, you wouldn't have got the infection if you didn't have surgery. And for this study, what they did was they analyzed 2012 data of 346 hospitals that were all involved in a American College of Surgeons quality improvement program. This was all published in the Journal of the American Medical Association. They say surgery patients need clear instructions with information on warning signs and who to contact day or night if symptoms do occur. They say the patients could seek treatment in the earliest sign of infection, which would include redness or swelling. And they go on to say hospital readmission rates are a focus nationwide to control hospital costs and improve quality of patient care. They say these infections at the surgery site are typically caused by bacteria entering the incision, sometimes due to bacteria from the patient's own body, and it's kind of trying to imply it's the patient's fault, or inadequately sterilized surgical instruments. They say in recent years, hospitals have beefed up the fight of these to fight off these surgeries by having staff hand washing campaigns. I mean, don't you learn to wash your hands, after you go to the bathroom when you're like 3 years old? I mean, it's like they have to have a campaign. They say these infections can be difficult to prevent, and in most patients studied, symptoms didn't show up until several days after they went home. They say incision infection was a reason for more than 1 in 3 unplanned readmissions. That's 30%. And for the at least 1 in 4 patients who had either hysterectomies, abdominal hernia repair, or colorectal surgery, hip and knee replacement patients, it was a reason for 1 in 5 readmissions. And for obesity, bariatric surgery patients, it was 11%. So no wonder the numbers are that you cite about how many people get sick with an infection in a hospital every year.
Well, yeah, thank you so much for bringing that one up, Doug. The Center for Disease Control back in March of 1998, and this is a yearly figure, said 2 million Americans are infected each year in hospitals, not clinics, but just hospitals alone, because the doctors don't wash their hands after they go to the bathroom. 2 million. And 90,000 of these people die each year. What would happen if Iran or Iraq or North Korea were to send over an intercontinental ballistic missile with a biologic weapon, infect 2 million people in a large population in Central America, and kill 90,000 people? We declare war on them. Well, here's one trade that does it every year in their workplace. They don't even get an OSHA ticket. And that's because they have been able to pay federal, state, county, and city legislators under the table to get them put into a position where medical doctors are the only legal monopoly in America. They're self-policing. They have no oversight by any agency. And when you look at the record, they kill, infect, injure, and pillage with impunity. Nobody loses their license. Nobody goes to jail. Absolutely amazing. That's why we have to take care of ourselves. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Alabama. And Betty, you're on with Dr. Wallach.
Well, Betty, you're on the air.
How are you?
Okay, how can I help you today?
Yes, I'm calling about to see what kind of nutrition that you can prescribe me for the for sarcoma or cancer.
Okay, what tissue is it? In the lungs or liver?
Well, lungs and he said below my waistline and my thigh. So.
Okay. Did it originate in the lungs or
my leg broke? So go ahead.
I'm sorry. Say again.
I said my leg broke first.
Okay, and they found the cancer in the broken leg.
Well, it's not in there now, but he just said it made my lungs. But I just probably need to strengthen my legs too, though, because I don't have full range yet on my legs.
Mm-hmm. Okay, how much do you weigh, Betty?
I weigh 174.
Okay, and do you have any other history of diabetes or high blood pressure, heart disease, or anything like that? Skin problems, bowel problems?
No, sir.
Okay. All right. Well, your immune system is your best friend when you have any type of cancer. Sarcoma is a cancer of soft tissue, tends to be, okay? Could be the soft tissue in the bones. It could be in the lungs, as you said. And so the first thing you have to do is stop the ongoing damage, stop anything you're doing that might drive the cancer to go faster or harder or stronger. That means you need to clean up your diet. Absolutely no fried foods, no exceptions. Absolutely no processed meats with nitrates and nitrites. It means absolutely no deli slices, sandwich meats, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, that kind of stuff. And then no oils, because they turn into trans fatty acids, heterocyclic amines, and acrylamides, all of which are really, really a negative and contribute to the, again, driving cancer harder and faster. So that means no olive oil, no coconut oil, no margarine, no mayonnaise, no salad dressings, and no cooking oils, and no gluten, because you want to maximize your absorption of the good stuff, and you want to reduce the amount of inflammation in your body, and you can do this, contribute to lowering inflammation in your body by eliminating gluten out of your diet. And that includes everybody in the household, spouse, mother-in-law, grandma, kids, dogs, cats, birds, fish. Everybody's got to be gluten-free. If everybody's not gluten-free in the household, you're going to get cross-contamination from the laundry, the food preparation surface, the couch where everybody watches TV, and the bed where you sleep together. Then, from a standpoint of giving your body everything it needs to support your immune system, I'd go ahead and have you take 2 of the healthy brain and heart packs per month, and that's going to give you what you need to support your immune system. I would also throw in 2 bottles of the glucogel to support your bones, 15 of those a day, 5 at breakfast, lunch, and dinner. And throw in the, hang on, because I got to run one of these messages. I'm going to give you a couple more things, so hang on here. We'll be back to you, Betty, after this message. Okay, Doug, let's go right back to Alabama and Betty so I can finish her little program here. In addition to the 2 healthy brain and heart packs per month and the 2 bottles of the glucogels, you can take 15 of those a day, 5 at breakfast, lunch, and dinner to support healthy maintenance and repair of cartilage, ligaments, tendons, connective tissue, and, of course, the 2 healthy brain and heart packs are to support your immune system. And then I'd also get on the Ocean's Gold, 3 of those tablets twice a day. There's 2 bottles a month for the sea cucumbers, and they're now becoming legendary for supporting your immune system when people have cancer. And then also get your ORAC points, your antioxidant points, ORAC, oxygen rack absorption capacity above 100,000 a day. You could do that with 6 of our Cell Shield RTQ, actually 5 of those twice a day, and 6 of the triple cheat chocolate a day, 2 at breakfast, 2 at lunch, 2 at dinner. And then call us every time you get more information from the doctor. Let us know how you're doing, and we'll walk through this with you. Okay, Doug, let's go to callers.
All right, let's head to Texas. And Danny, you're on with Dr. Wallach.
Well, Danny, you're on the air.
Hi, Dr. Wallach. It's such an honor to speak with you. My husband is 50 years old. He's 250 pounds. He's been on kidney dialysis for the last 4, going on 5 years. He has no urinary output. It's secondary, I guess, to lupus nephritis, I think they call it. Low protein, low magnesium, high creatinine, high BUN, He has alternating diarrhea and constipation and peripheral neuropathy.
Okay, do you know what his creatinine levels are?
They're high, like 14, 16.
Okay. And how many times a week does he do dialysis?
Oh, sorry, he's on peritoneal dialysis now. He was on the hemo, or if I'm saying that correctly, now he's on the peritoneal at home every day, every night.
Sure. Okay, so Shar?
Yes?
Okay, let me ask you, Danny, did your husband have diabetes or anything like that?
No, it was from lupus. Lupus.
Okay.
He used to have high blood pressure. I'm sorry?
He does have high blood pressure. Okay. Does he have any history of skin problems?
Yes. From the lupus, he had the butterfly rash.
Rosacea on his face? Mm-hmm. And does he have any history of any respiratory problems, asthma, bronchitis?
No.
Okay. Okay, Shar, what's going on here? What's this guy's problem?
He's got a gluten intolerance, for sure.
Absolutely. And, of course, what would you do because he has kidney failure? He's on peritoneal dialysis, which is a home procedure. He's doing it every day. Has not urinated in a couple of years. What would you do for this guy?
I would give him, well, if he weighs 200 pounds, I'd get him 2 healthy brain and heart packs, and then he's going to add the ultimate daily to open up the afferent arteries in the kidneys.
Okay, very good. Yep. Because he weighs 250 pounds, ideally here, Danny, your husband would be dosed for a 300-pound guy because he's got a couple of life-threatening things going on here, so you need to use a little bit of a heavier hammer. And hang on, we'll come back. Get your pen and paper ready. We'll come back with a formula for you after these messages. Okay, Doug, let's go right back to Texas and Danny. As Shar said, the most likely underlying problem here is a gluten intolerance. So your husband, yourself, kids, mother-in-law, dog, cat, bird, fish, everybody in the household has got to be gluten-free, no wheat, barley, rye, and oats. We want to maximize the absorption of the good stuff and stop the inflammation here, at least reduce it by getting off of gluten, no fried foods, no processed meats with nitrates and nitrites, no oils, and means no olive oil, no coconut oil, no margarine, mayonnaise, salad dressings, cooking oils. And when a person has kidney failure and very high creatinine levels, high blood pressure, it's because the kidneys are releasing a hormone that actually called renin, R-E-N-I-N, which drives up your blood pressure. The reason it does this is trying to get more blood flow into the kidney. And when you have kidney failure, usually there's not much wrong with the kidney, but there is a plugging of the afferent arteries, as Shar said, that carry the dirty blood into the filtering units. Now, these tiny little arteries, you can imagine, they're 10,000 times smaller than the diameter of your hair, so you can see how they would be very easily plugged from inflammation. And basically, what we'd recommend, of course, is 3. Now, remember, we're going to dose your husband for 300 pounds, and if it's a financial burden, don't drop any lower than for 2. But I'm going to give you for 300 pounds, and if it's a financial thing, then you can drop it down to 2 doses instead of 3. I'd give him 3 of the Healthy Brain and Heart packs per month. It would be 3 of our Ultimate Selenium at breakfast, lunch, and dinner, 1 ounce of the Osteo FX Plus at breakfast and lunch and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals Drop Dead Gluten-Free at breakfast, lunch, and dinner, 3 of the EFA Plus at breakfast, lunch, and dinner, and 3 of the EFAs at breakfast, lunch, and dinner. All those will be accomplished by the 3 Healthy Brain and Heart packs per month. And I would also give him 12 of the Ultimate Daily Tablets today. That's going to be 3 bottles a month of the Ultimate Daily Tablets. It'll be 4 at breakfast, 4 at lunch, 4 at dinner, and they're designed to support and promote healthy blood pressure levels and also to support and promote healthy blood flow through obstructed arteries, whether it's in the brain, the eyes, the heart, and the kidneys. Also, to also help increase blood flow through those obstructed arteries in the kidney, I would also give him 12 caps a day of what we call HGH. Be 6 at bedtime, a glass of water, 6 when he wakes up, a glass of water. That'd be 2 bottles a month. And they're designed to do a lot of things, including dilate blood vessels. Again, we want to increase blood flow through those obstructed arteries, see if we can't support the kidney's function, so the creatinine will come down, so he'll begin to produce urine again. That's our goal here. And let's see if we can't do that. We've done it many, many times before. Let's see if we can help you out here. Lupus is also due to multiple mineral deficiencies. It's not an autoimmune disease, but it is caused by malabsorption of nutrients. And so this whole program is designed to help your husband all these things. Call us every time you get creatinine levels, every time you go in for laboratory work. Call us. You probably do blood pressure at home. Let us know every couple of weeks how your husband's doing. Okay, Doug, let's go to callers.
All right, let's head to Alaska. And Doug, you're on with Dr. Wallach.
Well, Doug, you're on the air.
Hello, how are you?
Okay, what's going on?
Actually, my name's David. Doug is my friend. He's plugged in with you up here, and he called for me. And so here I am. I've got some issues dealing with some blood tests on a physical, and it was found that I had hepatitis C. And they did a biopsy of my liver, and I've got cirrhosis. And that was a couple of years ago, and we didn't have the insurance at the time. This last a month or so ago, I had blood tests done, and then I had an ultrasound, and they found one of the doctors said it was a cyst, the other one said it was a lesion on the pole of my left kidney. So other than achy joints, I'm 62, 280 pounds, and arthritis and achy joints. Other than that, I'm in great health.
Do you have any history of any asthma or skin problems or constipation or bowel problems or anything like that?
No, sir.
Okay. All right. Let's see here. Almost 300 pounds.
I might add this, I had hepatitis when I was 7 years old.
Yeah. Okay. And was that hepatitis C, or what do you mean hepatitis?
Well, it was hepatitis A. That was in 1959.
Okay.
Hepatitis C, I don't think was even known of at that point. But I had what the doctors thought was a relapse in 1980 of hepatitis, and of course they didn't know anything about hepatitis C back then either. It has since just a couple of years ago been diagnosed as hepatitis C.
Okay, we need to move on here. We don't have time for a long discourse here, so let me get going here. Char, this guy's 300 pounds. What would you do to help him with his immune system and make his liver happy?
Well, I would get him on 3 healthy blood or healthy brain and heart packs, and then I would give him. He should probably have. Well, he needs for his liver. He needs selenium for sure, but he also could use the oxybody for his hepatitis.
Okay. Very, very good. Okay. Basically, you got to get rid of all the bad stuff here. No fried foods, no processed meats, no nitrates, no nitrites, no oils, no gluten, no alcohol. All that's got to go away. And then you need to take, as Shar said, I would go ahead and start with 3 healthy brain and heart packs per month. That's going to give you 3 selenium, as Shar said, makes your liver happy. 3 selenium at breakfast, lunch, and dinner. 1 ounce of the Osteo at breakfast, lunch, and dinner. 2 scoops of the Beyond Tangerine 2.0 NutriCrystals, drop-dead gluten-free, breakfast, lunch, and dinner. 3 of the EFA Pluses, 3 times a day. 3 of the EFAs, 3 times a day. All to be accomplished by the 3 healthy brain and heart packs per month. I would also throw in the Killer Biotic, which supports your immune system. It has a blend of 8 herbs in there that support your immune system. 2 of those herbs actually have antimicrobial properties and can support your immune system in fighting off this virus. And so I'd have you take 9 of those a day, the Killer Biotic, 3 at breakfast, 3 at lunch, 3 at dinner. They'd be 3 bottles a month. And the cyst on your kidney, I believe, would be just an opportunistic finding. You may have been born with that. It's not related to anything else you're talking about. It could have been there from the time you're born, and then you can die with 120 and with it. Doesn't sound like anybody's too excited about it. And what would you do for the gentleman's joints, Char, bone and joints?
I give him glucogel, a lot of glucogel.
Very good. Okay, yeah, big fella. I'd have you take 20 glucogel capsules a day, 5 at breakfast, 5 at lunch, 5 at dinner, 5 at bedtime with a glass of water. And that's going to take 3 bottles a month of the glucogel to do that. And they're designed to support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes your bone itself. But they also support anything that is made up out of connective tissue, like blood vessels and so forth. So give us a call every couple of weeks. Let us know anytime you go to the doctor and get some status tests. We'll be back with Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 95 Crusade. And Doug, let's go to callers.
Let's head to Los Angeles, California. And Isaac, you're on with Dr. Wallach.
Well, Isaac, you're on the air.
Hi, Dr. Wallach. I actually talked to you last time in another show, but I couldn't write down the prescription you gave me. I have a problem with my knees. I have one knee, I have meniscus tear, and the other knee become like pain because they say tear and wear. Maybe like a starting of arthritis in the second knee, So both.
Okay, how much do you weigh, Isaac? Isaac, how much do you weigh?
200 pounds.
Okay. With 200 pounds, you have knee problems. Do you have any skin problems or asthma, respiratory problems of any kind?
Skin problem one time, like 2 years ago, I got like a rash. Mm-hmm. And now I have all the time, like in my back when I sit, like always pimple. They come and I squeeze them. They get bigger. I squeeze them and then they come out like yellow stuff, and then they cure and then come back all the time.
Okay. Well, Isaac, you have a basic underlying problem called a gluten intolerance. So you need to get rid of gluten out of your life. No wheat, barley, rye, and oats. Everybody in the household, spouse, mother-in-law, kids, dog, cat, bird, fish, everybody in the house got to be gluten-free so you can maximize your absorption of the nutrients. And no fried foods, no processed meats, nitrates and nitrites, no oils. And 200 pounds for knee problems, arthritis, this kind of stuff, I'd go ahead and take 2 of the healthy bone and joint packs per month. That'd be 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangy Tangerine 2.0 NutriCrystals, drop-dead gluten-free at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and then 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. All that will be accomplished by the 2 healthy bone and joint packs per month. It wouldn't hurt to throw in 2 bottles a month of what we call Bone Builder. It has other nutrients in there that are required for supporting, promoting, maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes its bone itself. So that's Bone Builder, 3 at breakfast, 3 at dinner. That's 2 bottles a month. And don't drink carbonated drinks with meals because it neutralizes stomach acid and reduces the efficiency of absorption of vitamin B12, minerals, and so forth. And so it's very useful to stay away from carbonated drinks an hour before meals, during meals, an hour after meals. And then give us a call every couple of weeks. Call us every time you go into the doctor, get some kind of report, and let us know where you're at, and we'll be happy to walk you through this. Okay, Doug, how much time we got here?
You got about 90 seconds.
90 seconds. Well, I'm going to go ahead and take it and encourage everybody out there in the listening area to get a hold of my new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, because your genes really don't control you. You control your genes, but you're going to have to supplement with the 90 essential nutrients, 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, to maximize your genetic potential for longevity and for health and for fending off disease and speed and strength and intelligence. You have to consciously, obsessively supplement. You can't eat well. You cannot eat well and get everything you need. It's impossible these days. There's all kinds of reasons for that. We go into that in great detail in the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. We're looking for help. The American public is really in deep trouble health-wise. The medical system has failed us. So if you're interested, contact your Youngevity associate and say, hey, not only do I need that book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, I want to be part of Dr. Wallach's army. I want to help out here and help save America by helping people with their health problems. And you become a student of this information, and you're going to help a lot of people. We can help you make your family a type 2 diabetes-free family within a couple of months. We can help you make your city and your county and your state a type 2 diabetes-free city, county, and state, diabetes-free, type 2 diabetes-free in a couple of months. This is really quite easy once you understand the things like type 2 diabetes are not genetic, as doctors will tell you. It's actually a simple deficiency of minerals, which we've known for 70 years. Well, stick with us. Contact us every day if you can. Thank you so much, Shar. Super job as usual. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.